someone who has cerebral palsy? You might be feeling uncertain about understanding and supporting someone with cerebral palsy, but we are going to answer your key questions in this video. Cerebral palsy is the most common physical disability in children, and managing it can be a challenge. Firstly, let's understand the term cerebral palsy by breaking them into two parts. Cerebral refers to the brain, and palsy means weakness or loss of muscle control. Thus, cerebral palsy refers to a loss of control of the brain in coordinating one's ability to move. As a result, it can affect one's posture, balance, and one's ability to communicate, eat, and learn. The brain is the command center of the body. It controls all of our senses as well as our ability to move and speak and when to do it. Cerebral palsy affects the part of the brain which controls motor skills. This means that a person's ability to control their movement is disrupted. Cerebral palsy is a brain disorder that occurs when the brain is developing, before, during, or after birth. As a result, the brain does not develop typically and can send abnormal brain commands to the rest of the body, affecting muscle control and coordination, muscle tone, posture, and balance. It also affects fine, gross, and oral motor movements. Cerebral palsy affects the cerebrum, which controls voluntary movements and higher-level skills such as thinking, reasoning, and controlling emotions. Damages often happen to the cerebral motor cortex at the back of the frontal lobe. This leads to reduced ability to control movement and posture. Since the brain controls most muscle movements, these individuals will exhibit signs of abnormal reflexes such as atypical posture, lack of movement control and coordination, abnormal reflexes presenting as jerky limb movements, problems with balance, loss of gross and fine motor functions, loss of oral motor functions, and a lack of muscle tone. The most telling of these is an impairment in muscle tone. Muscle tone allows us to bend and control our limbs. This way, it is easy for us to do things like sitting, standing, and walking. However, this is not the case for those with cerebral palsy, as their muscles don't coordinate well together. As a result, they may require the use of assistive technology, such as wheelchairs and standing equipment. It is very important to know that you are not alone. 1 out of 500 Australians are affected by cerebral palsy. This data is not unique to Australia, but also the different parts of the world. There are 17 million people living with cerebral palsy worldwide. The causes of cerebral palsy are unknown. There is, however, evidence to show that there are risk factors for cerebral palsy that occur during pregnancy or after birth. Risk factors that occur during pregnancy and birth include being male, having a low birth weight, being a twin or triplet, blood clotting problems in mother and baby, lack of oxygen in the blood, placenta problems, severe jaundice, and bacterial or viral infections such as German measles. Some of the risk factors for cerebral palsy that occur in the months after birth are stroke, viral or bacterial infection, non-accidental injuries, and acquisition of brain injury after birth. You probably have a lot of questions. Here are some of the frequently asked questions about cerebral palsy.
Is cerebral palsy genetic?
Cerebral palsy is not hereditary. There can, however, be a predisposition for other risk factors that lead to cerebral palsy, such as prematurity and heart problems.
How do I know if my child might have cerebral palsy?
Some signs that might indicate cerebral palsy are listed here. If your child has delayed development, for example, they cannot sit up or independently roll over by 6 months, they are not walking by 12 to 18 months, or not speaking in simple sentences by 25 months, this might be a sign of cerebral palsy. A baby with cerebral palsy might also have difficulties with feeding and swallowing, or feel excessively floppy or stiff when picked up. If you suspect that your child has any of these signs, you should seek assistance from a GP.
Will my child be able to talk?
Cerebral palsy can affect the coordination of the muscles that are involved in speech. For this reason, 1 in 4 people with cerebral palsy cannot talk. Some may be able to produce sounds and vocalize, but because of these coordination issues, they may not be able to form the sounds required for speech. For those that can speak, they may still be behind their typically developing peers in communication development. For this reason, it is important to monitor their communication early and seek treatment as early as possible. There are different ways that the body can be affected in cerebral palsy.
Diplegia involves muscle stiffness that predominantly affects the legs, with the arms being affected to a lesser extent. Hemiplegia involves the inability to accurately move the arm and leg on one side of the body. Quadriplegia involves all four limbs being affected. There are four classifications of cerebral palsy based on the symptoms that are shown. These include spastic, dyskinetic, ataxic, and mixed. Spastic cerebral palsy is the most common type. Those with spasticity have stiff muscles and restricted movements. This is the result of increased muscle tone in the arms and or legs. Movements are quick and rigid, making it difficult to control. This can make it a challenge to perform daily tasks, which require coordination of muscles, such as handling objects, moving, and even speaking. Dyskinetic cerebral palsy involves involuntary soft or jerky movements of the hands, arms, or legs. This can make it a challenge to perform daily tasks such as sitting or walking, or coordinating the muscles of the mouth for speech. Ataxia refers to a lack of coordination and is the least common type of cerebral palsy. People with ataxic cerebral palsy have a particularly poor sense of balance and walk with a wide-based gait, which may be described as drunk. They may be viewed as being clumsy, as precise movements like riding and walking can be difficult. Involuntary muscle contractions can cause increased difficulties with coordinating movements and maintaining posture. Cerebral palsy affects the language centers in the brain, interrupting individuals' ability to plan and use verbal language. 80% of people with cerebral palsy have communication difficulties, with 25% unable to use words to communicate. Therefore, they are at an increased risk of learned helplessness, as they become passive communicators who do not initiate conversations. Language is a system of communication that can be both written and spoken. Speech is the ability to plan and pronounce certain sounds within a language. Loss of muscle control in the tongue, mouth, and throat may impact speech production and vocal quality. Non-verbal ways of communication, such as gesturing, may also be impacted due to the inability to coordinate certain muscle groups. People with cerebral palsy do not have full control over their body movements. Some may have difficulty articulating speech, which can affect clarity and ease of speaking. Some may sound quite effortful due to reduced coordination of speech and respiratory muscles. Others may have abnormal speech rates, whereas some may have quite a nasal sounding voice due to too much or too little air coming out of their nose. A soft volume may also be noted. Cerebral palsy can cause a number of constraints on an individual, these ranging from difficulties in walking, talking, and feelings of physical pain. Difficulties with speech, movement, vision, and cognitive tasks can affect a person's participation in everyday activities. Their reliance on others can result in a lack of independence. It may also be more difficult for them to form social relationships, particularly if they have communication difficulties. There may be greater difficulty in more cognitive, demanding tasks due to their learning difficulties, shortened attention spans, perceptual difficulties, and challenges with language. Some individuals may also experience chronic pain, muscle spasms, and decreased ability to move throughout the night, which can affect their sleep and overall behavior. Research shows that the availability of a good environment is directly related to increased participation in daily activities. Modifying the environment to accommodate the individual's needs allows for activities to be more accessible, provide social support, transport, and encouragement to enable the individual to reach their full potential. Research shows that families that are involved in goal setting provide for greater functional gains for the child. It also allows the individual to adapt better when participating in social activities. In addition, living in an environment that is adequately equipped with required resources empowers the child with cerebral palsy, this allowing them to better participate in daily living routines. Caring for a child with cerebral palsy can have a direct impact of the quality of life on the parents as well. It can be both difficult and stressful. Feelings of loss and uncertainty can be hard to manage. Studies have also shown a link between feelings of depression, anxiety, and post-traumatic stress.
It's good because supported, and I think, it doesn't surprise me that families who are less supported have issues with depression and ill health.
What quality of life? I don't have one. I really don't. I have absolutely no social contact other than the support group that is still there at Giddy.
Studies show that there is a link between cerebral palsy and higher chances of depression and anxiety, behavioral issues, and lack of independence. Cerebral palsy affects an individual across the lifespan. At the preschool age, opportunities to explore the world may be deprived due to children with cerebral palsy being more passive in nature, leaving them more socially isolated. For school-age children, social contact and opportunities are drastically reduced with the reduction of free playtime in school. And for young adults with cerebral palsy, the transition to early adulthood is an even more complicated process as they rely on activities planned by adults rather than spontaneous activities with their peers. Strategies to promote effective communication with your child. Use assistive technology, listen carefully to when your child speaks, take time to adapt to the rhythm and tone of your child's speech, be creative and patient, and work with a speech pathologist to find out which communication strategy will work best for your child. It may not always be easy to care for an individual with cerebral palsy, but you can be your child's best advocate. Here are some helpful websites to take a look at.